The need was to reach a demographic, a group of people that was of significant size and with very critical and acute health problems. Already there existed in the downtown east side 2 health clinics, but they were still not able to reach a significant number of people.
Like, we're non-entities down here. Like, we don't exist, really. Like, you know, I straight up just...
I would challenge anyone to show me a clinic in this country or in North America that sees the volume of visits that we do, 800 visits a day, 365 days a year. That kind of volume for $2.5–3 million a year, it's not possible. You won't find it. This is an extremely cost-effective public health project. When you find populations, significant populations of people with significant addiction issues, you're going to find sexual abuse and psychological abuse and addiction in the family, entrenched addiction, that kind of thing. And so there are a lot of people are people who have been born into or grown up through really traumatic situations. And they're basically people with post-traumatic stress disorder.
The absolute epidemic in HIV and Hep C transmissions in this neighborhood was a huge part of that. But the biggest thing I think that we do for people is we actually are, we help try to rebuild people's self-esteem, or we accept people. People are drug users. We know they're drug users. I still hug them. You know, my goodness, they're my friends. I have more in common with the population that uses here than I do with like 99.9% of the rest of Canada's population.
They do what they're supposed to do. They support us as individuals to help us to be the best that we can be for whatever day it is that we're in, whatever mood or feeling we're in, you know. I mean, I croaked in that alley back there. I overdosed. I was, Dad, catch that, eh? 12, yeah, and again, 12 minutes.
Well, the most obvious service we provide is protection from overdoses. We're the pros, I think in North America for sure, we're the only injection site in this country. So we're obviously great at dealing with overdoses. The unsung stuff that we do, though, is accessing people to health care, even if it's just saying, gotta go see a doctor, or getting them a doctor's appointment.
At the hospital, we get treated like garbage. Like, we're subhuman, like, you know, so. I don't like the hospital. I'd rather let these guys deal with me. Like, if something happens, and just, no, don't take me anywhere, like, I'll be fine. Put me in the corner over there, watch over me, yay, you know. And they are, like, way better, and they do they treat us all as individuals, like, and we all get, like, it's not like choosy. Everybody here gets treated well.
The clinics are a top-down model. You need to design this from the ground up. You need to have partnership in the community, you need buy-in. And in the downtown east side, you need to tailor your public health services to that population. What is the population capable of? What does it need? How are you going to do things like paperwork if the population has mental health issues and issues around literacy?
You get to know people, you get comfortable with people, they get comfortable with you, then they feel much more comfortable about accessing services. Insite deals with a marginalized, street-entrenched group. You know, we are right on Hastings, and we are low threshold, so we really want to reach out to those people. They have enough misery in their lives, they don't need to foreground it. They appreciate a joke, they definitely appreciate respect, and if you treat them that way, they will generally treat you very nicely.
It feels proper to be in here. I don't need to worry about the police coming up on me, and I can use without hurting myself. Like, if I need help, then there's trained individuals here to assist in whatever it may be.
The relationships with participants here are the best part about the job. You know, it's just a matter of helping people out in their day-to-day life, and oftentimes even getting someone a clean pair of socks can make the relationship stronger. You know, someone's having a really crappy time, and they might just want a cup of hot coffee.
Other stuff we do is trying to access people, getting people hooked up with Strathcona mental health if they have mental health issues and aren't on anyone's radar. Getting people into housing is something we do, except there are issues about there's not much housing, unfortunately, especially at the poor end, except in really in SROs.
I've been homeless for the last year. I know, for instance, the Park Hotel has 84 apartments or 83 apartments in it, and there's only like 8 people living there right now while renovations are going on. The Savoy and the hotel across the road from it are completely empty. There's nowhere to live right now for a lot of people. It's impossible to find a place. The Cosmopolitan that I moved out of, it was infested with cockroaches, with bed bugs, and the reason I moved out was not only the bed bugs, but the mice had eaten into my bed. They'd eaten through the welfare gives you bed covers, plastic ones that zip shut, and the mice had eaten through that and were nesting in my bed, and management refused to do anything about it.
People can't actually get out of survival mode and deal with their issues of trauma and abuse until they have a permanent spot, unconditional home that they can be and work through their relationships and work through their things with and get help and get, you know, and become part of a community. They can't do it unless they've got a permanent spot. Anything less than that is a disservice to people who've got health issues.
Insite's extremely necessary for the neighborhood and for a population of users who need to maintain their life, and just understanding the population and understanding that it's a problem that isn't just going to go away.
It's incredible. We've gone from, initially when this project was opened, there was a whole population of marginalized people who weren't accessing any kind of services in the city. And this project here brought them into some kind of access. And in the early days, it was very much like the Wild West here.
People aren't in the alleys. They're not sitting out there like, you know, using or yelling or flailing or swearing or fighting. You know, they're not out there doing any of that. We're in here, and it's, you know, there's rules and regulations, and, you know, it's helped the individuals that do come in to relearn some manners, like, you know, because otherwise they don't get to come in. They have to deal with the police coming, you know, down the alley, and they have to be concerned about those kind of things if they get barred out of here, if they act up, or, you know. So it actually has put structure into individuals' lives, and they don't use as much, I find.
I do talk to regular users of the site and who have brought people in, you know, people they see in the alley, and they're like, what are you doing out here? Let's just go a couple blocks. So that happens a lot.
If it wasn't for that place, I'd be dead. Somebody put ketamine in the heroin. And then all of a sudden I was coming to, standing in front of Army and Navy. Safe Ride was letting me off with a blanket wrapped around my shoulders. I had no clue what had happened. I had died from ketamine, and they brought me back.
The number of overdoses at our place is over 1,000. We've had not a single fatality with those overdoses. As far as building relationships with new people, that's what makes our place work. Most injection sites in the world have, you know, security guards. We have none, and we're the busiest injection site in the world by 2 or 3 times.
Insite is about relationships, and so we know people and try and keep track of them, even though they have really chaotic lives out on the street, and try and look for them and encourage them to come to treatment, or encourage them to get medical help, or, you know, you really have to encourage people. You can't force people. You can't coerce people. You just have to try and open the doors for them and say, hey, ready when you are.